10th one, which nerve is blocked when local anesthesia is given below the inguinal ligament during femoral vein catheterization? It is femoral vein. So you have to give a local anesthesia to the genitofemoral nerve. Okay, genitofemoral nerve is blocked below the inguinal ligament during femoral vein catheterization. This genitofemoral nerve is L1, L2 of ventral rami. 11th one, which among the following statement is true regarding the course of mandibular nerve? First one, auriculotemporal nerve is a branch from anterior division of the mandibular nerve. It emerges from behind the temporomandibular joint. See, when you think this is a very long question and you don't know the answer, please go through it. Auriculotemporal is supplying the ear, isn't it? So it should be posterior, not anterior, right? Nose, mouth are anterior, but ear is posterior, right? So let's think this is wrong because auriculotemporal is a branch of posterior division. Let's think like that. Next, buccal branch is a branch of anterior division. We can assume, isn't it? It is an anterior division. I'm just teaching you in the way that you don't know anything about the mandibular now. Okay, at that time you should think like that. Buccal branch, buccal means in anterior. So anterior division of the mandibular nerve. Yes, it emerges behind the mandibular ramus. Yes, might be. Next, lingual nerve is a branch of posterior division. Tongue is still posterior, isn't it? It's not just the tongue is anterior. It might be supplying anterior side of the tongue, but it has to come from the posterior division and it arcs around the submandibular duct. Yes, the ophthalmic nerve is a branch from the anterior division of mandibular nerve. It arises in the middle cranial fossa. Actually, why ophthalmic nerve should be coming from the mandibular nerve? It is a division of the trigeminal nerve. So fourth one is obviously wrong, isn't it? So these two has a four. So I'll write this is wrong. Whereas we know that first one auriculotemporal is also wrong only. Yes. So only remaining option is A. That is 2 and 3 are correct. Understood how I got this? First option we thought this wrong, but we don't know about third one. We might be confused. Let's see. But fourth one is obviously wrong, and first one is also wrong. Hence, only remaining option is A. Let's see the diagram once so that you will remember. See, lingual branch is coming from the posterior division. This is the anterior division. Here I have written a very simple diagram. This is from the main trunk. Two branches will come. That is nervus spinosus and the nerve to medial pterygoid. It will supply to the medial pterygoid, tensor tympani, tensor ali palatine. And this is the posterior and this is anterior. Posterior is for auriculotemporal and inferior alveolar. See, inferior alveolar branch. Here there is mental nerve. There we have saw mandibular artery. There we saw mental artery. This is the anterior division, muscular branch and deep temporal and buccal nerve. See, buccal nerve is coming front. Whereas lingual nerve, they told it will arch in the submandibular duct. Yes, correct. See, first option, auriculotemporal nerve emerges behind the temporomandibular joint and is a branch of posterior. They have given in the question that is anterior. Ophthalmic nerve arises in the middle cranial fossa. Okay, that's okay. But it is a division of trigeminal nerve, not a branch of mandibular nerve. Okay. 12th one. Arrange those cells according to their position from the basal layer towards the lumen of seminiferous duct. Okay. First, there will be myeloepithelial cells. Okay. Okay. 5. Two options are there, 5, C and D. So A and B got ruled out. After that, there will be spermatogonia will be there. So 1 should be 1. After that, primary spermatocytes, that is 2. Then spermatid, and next it will form a spermatozoa. So option D is the answer. You can see Myeloepithelial cell, spermatogonia, spermatocytes, primary spermatocytes, secondary spermatocytes. Next, spermatids. When spermatids gets a small tail, then it is a spermatozoa and it is called as spermiogenesis, and whole process is called spermatogenesis. Okay. 13th question. What is the volume of prostate in normal adult? This type of questions they will ask like one bouncer questions. This is 20 cc is the answer. 14th one, arrange the lung hilar structure from anterior to posterior. Okay, let's think this is anterior, this is posterior, anterior and posterior. First there will be vein, then there will be pulmonary vein, then this is a lung, right? So lung hyla means lung should be given more priority. So we'll give a pulmonary vein first, then pulmonary artery, then primary bronchus. Okay, primary bronchus, then coming to bronchial artery. So vein first, three first, only one option is that three first, then artery, four, then bronchus, one, then two. Here you can see the picture. After primary bronchus, you can see the bronchial artery. Bronchus, bronchial artery. First pulmonary vein and artery, VAB. You can remember VABA also. VABA. First, you should not confuse between it's it a bronchial artery or a pulmonary artery. First, in the lung, we are giving importance to pulmonary vein and pulmonary artery. Next, we are giving importance to bronchus. Then bronchial artery. Here you can see this is the pulmonary vein. This is the pulmonary vein. This one is the pulmonary artery. Then bronchus. Here this is the anterior margin. This is the left lung. This is the posterior one. Here you can see the pulmonary vein, artery. This is anterior, okay? Pulmonary vein, artery, then bronchus. Okay. Almost everything, the vein will come first, then artery, then primary bronchus, then bronchial artery. Okay, let's continue other questions in next video. Thank you.